And hello and welcome. My name is Richie Hedeman, founder and head coach of Hurricane Fitness, and today we're interviewing Dr. Kevin Laudner, the head of the Kinesiology Department in Illinois State University, and he has just finished giving us an absolutely fantastic tour of the facilities. Dr. Laudner, thank you very much for being on the interview, and thanks very much for actually having us over here.
Oh, glad to have you. Yeah. It's been a great afternoon so far.
So just real quickly, would you mind telling us a bit about yourself, your own history, where you got into fitness and therapy, where you got, how you got to where you are today?
I think very similar to a lot of people in this area. I was always involved in sports from a young age, and especially on the athletic therapy or the athletic training side. It was an injury when I was younger that kind of started my path down the road. I didn't even know that was a career. I didn't know it existed. But once I was injured, I was sent to a therapist who I worked with very closely, and got to see what they do, and got to see kind of their day-to-day activities and how they were involved with keeping people active, both from a prevention and a treatment standpoint. And the idea of being able to work with athletes that are driven and excited about being active like I was, it was something that really appealed to me. So that's kind of what started it. And then, from there, I went into an undergrad degree program that was very practically based, a lot of clinical hours. So we had to do, I think, 1,400 or 1,500 hours of clinical experience in addition to our coursework. So by the time you graduated, you really knew what it was about and whether or not that was something you did. It seemed like every day, every hour that I worked, I got more and more excited about it. So I finished up my undergrad degree, went on to a master's program where I worked at the same time. After that, I worked for a few years in clinics and at university level, working with different teams and different athletes. And a few years later, I went back and got my doctoral degree. And after that, that's when I kind of developed my love for research and a little bit more of the science side. And after that, that's when I came to Illinois State.
Okay, you were offered a teaching position there then?
Yeah, I started as an assistant professor, and I worked my way up from assistant professor to associate, and now a full professor and director of the School of Kinesiology and Recreation.
Fantastic department it is, from what I've seen.
Very lucky to be involved with them.
I suppose you're probably the perfect person to ask this question from, because this is something that certainly in Irish institutions that we are struggling with. What would you lean towards in terms of what makes a truly proficient athletic trainer or therapist? Would you lean more towards experience, practical experience, or more towards theoretical or scientific knowledge? Which would you say, or would you say they're equally important?
Yeah, I really think you need both. One without the other. I know a lot of people who have the practical side, and they know at this time in an injury this is what you're supposed to do, but they don't know why. And that's when it becomes problematic, because there's no cookbook approach to every patient. So you can't do the same exact treatment for every single grade 1 ankle sprain, because every patient is different. They heal at different rates. They have different requirements based on their sport, based on how much muscle they have or previous injury, whatever it is. So there is no one set approach. And somebody that just has the practical side of it, a lot of times they have that, well, I know that I'm supposed to apply ice at this time of the injury, and they don't have the reasoning or the scientific approach behind it to change that program if they need to. But on the other side of that, if you only have the scientific aspect of it, well, science shows us that the body reacts the way it does, but not everybody does that same way every single time. So you've got to have some experience behind it as well. So at least in athletic training or athletic therapy, you really need to mesh both the scientific and the practical applications together to come up with your best treatment, because it's not a one-size-fits-all. Ever. I've never treated the same patient. I mean, I've treated a million different ankle sprains, and I've never treated any ankle sprain the exact same as I did another one.
Yes, certainly diverse.
It's always different. It's always different no matter what. It's going to be different. patient's different. Their what they want to accomplish is going to be different. Their body, their tissue adapts differently. So you got to be able to mesh the two together.
Yeah, certainly. Like with talking about diversity is one of the key issues, and probably even one of the key problems to why sports science is never an exact science.
Oh yeah, absolutely.
Yeah, but I mean, okay, so I mean, we looked at, I mean, back in the 90s, the early 90s, I mean, athletic therapy and training was unheard of. I mean, there was nothing about it. I mean, you came in, you did your jog, your light stretching, and you basically went on in your workout, and if you got injured, you went to see a physiotherapist. And all of a sudden, then we got Gary Cook, we got Kelly Starrett, and all of a sudden it exploded on the scene. Everybody now is using foam rollers or tennis balls or self-myofascial release. We're now starting to care about muscle imbalances, or we're now starting to care about corrective treatment. We see everyone doing band pull aparts, or we see them doing myofascial release of the hips, and we see the likes of Becoming a Supple Leopard selling over a couple of 100 million copies. So I mean, why do you think that that this industry all of a sudden kind of exploded onto the scene? Where do you think it is now, and where do you think it's going to be in the next 5 to 10 years?
Yeah, it's I think we, like you said, it's exploded, and we've made some major progress in the area, and it is gaining popularity, but I think it's going to get bigger. It's going to become more popular, and we've kind of talked about this a little bit, but you're going to see it more with masses. So it's not just the elite, and that's where it kind of started. The elite athletes were getting these treatments, and then it started to work its way into the college level and some of the younger athletes. But this type of science is for everybody. Yeah. And we've talked about this before, but it's not just for the people that are playing sports or that want to be active, but it's for the people that want to be able to pick up a gallon of milk without having shoulder pain, or be able to play with their kids without having their knees crack and pop, and be able to get out of a chair. So I think it's gaining in popularity. People are understanding the benefits of it. They're understanding how it applies to the elite level 20-year-old as much as it applies to the 80-year-old that wants to be able to do that, to be able to garden or whatever it is. So I think it's growing in that aspect, and you're starting to see it branch out into different areas, not just with the athletes that are in the clinics, but it's branching out into other areas as well. And that's part of the reason why we're seeing at the educational level why it's becoming so popular with students. So I really think we've got a long ways to go, but it's moving in the right direction.
Yeah, and tell us, what do you think? I mean, like we mentioned there a second ago, that it all really started in the sense you got injured, you went to your ordinary clinical physiotherapist, the guy you see in the hospital, the guy you see in the doctor's office. I mean, where do you think gives athletic therapists and trainers the edge, or even more commercial healthcare professionals sort of an advantage or disadvantage over clinical professionals such as MDs, such as your ordinary consultants or your ordinary physiotherapists?
Well, I mean, everybody has their area. The thing about athletic trainers is they are educated when working with athletes, and I think there should be a relationship, because we have a very narrow educational and practical experience, and so do MDs, and so do therapists, and a lot of times in a lot of the clinics I've worked with, you don't just see one person. Just because you're an athlete doesn't mean you just see me. I work with you on the athletic side, but there's also other areas where you benefit from working with a physical therapist or from the doctor. So you really need to kind of mesh those together. But in some of the most successful clinics I've been at, a patient will initially work with the physical therapist, initially after a surgery or whatever the injury to regain some of their function. But then when it comes to the really functional side of it, the athletic side of it, then they transfer them over to me because I have that background. Athletic trainers, they kind of joke sometimes that they're the jack of all trades and master of none type of thing, and so you really want somebody that can specialize in that area. So it takes a team to really to treat these people, and when we talk about sports medicine, it's such a broad umbrella of there's athletic trainers, there's physical therapists, there's nutritionalists, There's doctors, so there's so many people, and they each have their specific role in working with those individuals.
Right. We did say earlier, I suppose we'll bring up the hot button topic now. I mean, do we think that there seems to be a bit of an, certainly I've seen that there seems to be a bit of an over-reliance on, say, correcting muscle imbalances or soft tissue release over the likes of achieving training goals? Have we become a little bit, do you think we've become maybe a little bit too obsessed with the likes of the athletic therapy side or preventative strategies now, as opposed to actually achieving performance goals, which sometimes the athletes seem to need above all else? I mean, that is what it comes to.
Yeah, I mean, I think some people certainly do that. It's probably, it's kind of a hot thing right now. It's one of those areas that it's grown in popularity. People are really focusing on it, but is it the only thing we should be doing? Absolutely not. Yeah, I could see how some people, focus on it a little too much, and it definitely has its place, just like all the different treatments and techniques we use. But sometimes people think, well, a little bit, is a good thing, and a lot is great. And they focus just on that. That's certainly not what you want to do. So that's not the approach you want to take.
So, I mean, you talked about techniques there. I mean, as you said, you've treated a lot of patients, you've treated a lot of athletes, you've worked with a lot of people. What would you say is your favourite, or what you found to be the most effective technique in treating either soft tissue injuries or preventing the likes of strains or injuries in populations, either athletic or casual?
The best technique that's
as a form of rehab or prehab.
That's really good. This is maybe a little bit general of an answer, but my background is in manual therapy, and I found that manual therapy is really effective for a lot of different reasons. But it has manual therapy has a lot of benefits in terms of both strengthening and stretching tissue. I found that patients really like the hands-on approach as well. Sometimes it has maybe some placebo type effects, just like a lot of treatments we do. But I think the one-on-one interaction sometimes is very beneficial, and it's also it gives the manual approach gives you a better idea of where tightness or where restrictions are, because when I can actually put my hands on somebody and feel what direction they're tight in or what direction they're weak in, rather than putting them on a foam roller and hoping that we're hitting the spot that's tight, I feel like I get a little bit better sense of what's going on, and I think it's a little bit more effective treatment. We can really isolate what tissue is tight or weak and focus on that, rather than doing kind of a shotgun approach. And
I do think that's sort of I can sort of highlight the issue that some people have had. They kind of, with Kelly Starrett's book, or with the kind of explosion of self-myofascial release that we kind of think we can do it ourselves. Who needs a therapist? It hurts, so I'll put a foam roller on it. It's tight, so I'll get the spine roller and I'll roll up and down. But I mean, I don't think we kind of get the feedback from doing it ourselves, especially an untrained individual doing it themselves, as they would with an actual therapist working with them. So
it's funny because something like myofascial release, at least in my opinion, is one of the toughest things to teach, because when I talk to students, they say, okay, well, what do I do? What direction do I push them? And I'm like, well, you push them in the direction where you feel the tightness. So I can't tell you that you push them in this direction or you do this to the tissue. You have to feel it, and once you do it enough times, you feel what direction they're tight in, and that's what guides you. It's not push them anteriorly for 5 seconds or whatever the case may be. It's you move them around, you feel for the tightness, and then you move into that direction. So, that's the benefit of it, but it's also one of the things that a lot of students have the toughest time figuring out, because they want to be told, what do I do? Well, it's a feel thing.
Yeah,
and that's why it's so
experience in a sense.
Yeah, absolutely.
Working with as many people as you can. But so I mean, I find that certainly in Ireland and in Europe, I'm not too sure about the States, but certainly athletic therapy or the likes of manual therapy is seen as a bit of a luxury. I mean, usually insurance companies will pay for physiotherapists. They'll pay for the likes of osteopathic or the likes of actual medically degreed or medically certified professionals. However, they're a little, they they see the likes of manual therapists or personal trainers or even athletic trainers as sort of luxuries. But I think that we've sort of seen that that kind of luxury position that the industry's been placed in, we've had to develop a sort of connection with our clients. We have to, because it's such a commercial field, we have to actually make them feel special. We have to establish a personal connection as opposed to a physiotherapist who's quite clinical. Do you think that the actual personal connection can actually help the results, or can basically set us apart from like some medical professionals like physiotherapists or MDs?
Oh, absolutely. And it's similar to the States, where insurance companies kind of dictate how many appointments you can have, and you have to see you're seeing 5 patients an hour or whatever the case may be, so you have a limited time. So to be able to have a little bit more one-on-one time with other individuals like athletic trainers, personal trainers, I think it can make a huge difference. We have a lot of professions that don't have that luxury, and right now, luckily we do. Working in a college setting, it's nice because you can see you have an athlete, you see him from day one, immediately from when they're injured. You see him every day. A lot of times you see him a couple times a day. You can focus all your attention on them, and you don't get that luxury with a lot of professions. So it's something that's nice about our area, and it's certainly, in my opinion, it's a huge benefit to the patient.
First, a great advantage. Yes. So last few questions, don't keep it too long. But so I suppose, being that athletic trainer and that therapist, I mean, you've seen an awful lot of injuries. So I suppose one good question that a lot of people like to know: what sports have you found the most long-term injuries or short-term injuries to be in? What sports in your mind would be the most damaging over the long-term or short-term?
I've seen, obviously, with American football, I've seen some really, really bad injuries. Maybe surprisingly, I don't know, but some of the worst, or a large majority of injuries occur in gymnastics. Gymnastics and cheerleading as well.
Very close
really
sports.
bad. Cheerleading, maybe some of the worst, because sometimes they don't have the support system and they're doing flips and jumps. I've seen some pretty bad injuries there, but with gymnastics, just about any injury can be sustained by a gymnast, whether it's overuse or acute injuries. They have just about everything. I mean, they're amazing athletes. They're so fit, so flexible, so strong, but the forces they create on the body, you can really break it down, whether it's over time or in one instant, tearing ligaments or breaking bones. So each sport has their group of injuries that they're most susceptible to, but gymnasts, they can get just about anything.
Probably explains why there's not too many 35, 40-year-olds
exactly.
going around.
I think they peak around 18.
Not a master sport, certainly.
Absolutely.
So then I suppose second last question would be, we do see, and one big difference, and probably a gaping hole in the industry, is that we see with the medical association, we've got international associations, international governing bodies. We've got the American Medical Association that govern medical practices. We've got the American Chiropractor Association, but we don't actually have an umbrella organisation that actually govern or formally govern, according to government mandate, the likes of healthcare professionals such as personal trainers, strength and conditioning coaches, and athletic trainers. Do you think that that's something that's on the way? Do you think it's something that's needed, or would you like to see it?
I would love to see it. Whether or not it's on the way, I'm not sure. If it is, I think we're a long ways away from it. And I don't know exactly where to start or who would drive that, but it certainly could be something that's beneficial. But right now, these things takes so long to develop something like that, and there's very few people talking about it. At least in my area, I don't hear much about it. So I would imagine that if it does happen, it will be quite a ways down the road.
Right. And you were talking there at the end then about the likes of insurance, and insurance kind of dictating a lot of terms, and sort of seeing our field as a bit of a luxury. Do you think that down the road, in the near future, we probably will see insurance companies take on, or insurance companies, especially now, seeing as how there's sort of more competition out there for insurance companies. You start to see more coverage for the likes of athletic trainers, therapists, manual therapists, or even strength and conditioning coaches. Or
yeah, and we are seeing more. It's a struggle to get them to maybe to understand exactly what it is we do and what we're capable of doing. But just within the last 5 years or so, there's been huge progress in that area. So we're able to bill a little bit more for some of the services we do. But it's a struggle because they want to make sure that they're paying for the right care, for the right services. But yeah, that's something that some of our governing organizations are fighting strongly for us right now. So I've seen progress within the last several years, and I think it's only going to get bigger. But it's certainly a struggle, just like everything else.
Fantastic, certainly something we can look forward to.
Yes.
Hopefully in the future. Well, Dr. Laudner, thank you very much for this interview. It's been an absolute pleasure. Thank you very much for the tour around the campus, and certainly hope to see you again.
Great, I enjoyed it. Thank you.
Dr. Kevin Laudner, thank you very much, and that was an interview of Hurricane Fitness. An absolute pleasure here at ISU down in Illinois, Chicago, and we'll see you at the next one.